your second year residency, what year is it now?
2015.
Okay, so it's 2015, and that's when you blow up on social media.
Yep. BuzzFeed. I was on Instagram, and BuzzFeed wrote a really superficial article saying you need to check out this hot doctor and his husky.
And what? It was the same dog?
No, different dog. She lives with my dad now.
What kind of videos were you making?
I wasn't making videos.
What were you doing?
I was
just
using
pictures?
Instagram as a daily vlog with pictures. Video wasn't big then. I mean, YouTube was definitely around, but I wasn't on YouTube at all.
So you started Instagram, they wrote an article, and that blew you up.
That blew it up, picked up 1 million followers over the course of a week or so.
Some good pictures.
I mean, it was that moment in time where a lot of regular people were going viral for looking a certain way. And, you know, as someone who wanted to be taken seriously as a professional, it was a weird situation to find myself in, because I was facing a crossroad. Do I accept this and lean into the whole sexy doctor thing? Or do I say, no, this is great, but I'm going to keep practicing doing my residency?
Yeah.
And I viewed that there was probably a middle ground somewhere where I could use that sexy doctor thing to get me invited onto talk shows, news, whatever, and then give some kind of meaningful primary care messaging, lifestyle changes, the issues with healthcare, and it worked. But because this was legacy media inviting me onto the talk shows, they had their own agenda. I remember going on one of the entertainment shows, like on Channel 5, and it was supposed to be a segment about how going to the gym is healthy for you.
Okay.
And I would walk into the segment. There was supposed to be a producer or the reporter, and they're like, all right, so can you take off your shirt and like start exercising? And I'm like, okay, like you would never ask any doctor in the hospital to do this. I just left because the fame wasn't what was important to me. It was just a mechanism to talk about the health stuff.
Right.
And I didn't want to do it for that. So I realized that's when I needed a YouTube channel.
Right. It's really interesting because, you know, I did a poll on my LinkedIn, I think last week. And it was funny that we're doing this today because I actually planned this. I scheduled it out, you know, a while ago. But the question was, do you take social media doctors seriously?
Seriously, yeah.
And the vast majority on LinkedIn, you know, obviously say no.
Yeah.
But I do think that it's pretty evident that you have changed that. Like when I talk to you, it's clear that you actually know your medicine. You're not just a hot doctor.
I bet you never thought you'd say that on this podcast.
Like you actually know your stuff.
Sure.
And it's fairly meaningful. How many days of work how many days a week are you working at the hospital?
2 to 3 days a week, depending on the week.
Right. So
and one of those days I'm precepting residents. So
you're what?
Precepting residents. So I'm teaching residents while they see patients. I would basically approve or sign off on their prescriptions, watch them do the procedures, all that kind of stuff.